Welcome to another episode of the Embracing Joy podcast. I'm so excited for our special guest, Dr. Brittany Panico, to come and speak with us today. Let me tell you all a little bit about her. She earned her medical degree from Lake Erie College of Osteopathic Medicine in Bradenton, Florida. She completed internal medicine residency and rheumatology fellowship at Loyola University Medical Center in Maywood, Illinois. He is affiliated with Edward Hines and the VA Medical Center for a few years as a resident fellow and attending moonlighting. And she's a prior rheumatologist with Northwestern Regional Medical Group in Geneva, Winfield, Illinois, and Banner University Medical Center in Phoenix, Arizona. She's a clinical assistant professor at the University of Arizona in Phoenix, and she's also a guest lecturer at Creighton Medical School in Phoenix. She's a fellow of the American College of Rheumatology. She's very passionate about treating the whole patient and identifying barriers to quality medical care. And she treats systemic lupus, Sjogren's, gout, rheumatoid arthritis, psoriatic arthritis, thyroid eye disease, ankylosing spondylitis, vasculitis, autoimmune myositis, recurrent pericarditis, osteoporosis, and other autoimmune and autoinflammatory conditions. She also speaks on many platforms such as ours. So she talks about preventive rheumatology and how we can use medication, diet, and lifestyle changes to prevent severe joint and organ damage. She talks about using social media to educate patients so that they can make informed decisions regarding their health care and develop optimal healthcare team for their unique needs. She talks about thriving after burnout and Made for More 2 co-authored an Amazon best-selling book. So she also talks about disease state awareness for varying rheumatologic conditions. So you have a very impressive resume, Doctor, very impressive. You've done a lot and you speak a lot about what you've done, which makes it even more powerful. So with that being said, today's topic is empowering patients with rheumatic diseases to live joyfully. And I think you're an expert on this topic.
Well, thank you for having me.
Yes, it's such a pleasure to have you. So before we get started into our questions, we'll play our warm-up game, which is convergence. So on the count of 3, you say the first word that comes to mind. Okay. 1, 2, 3.
Flower.
Joint. Joint and flower. Okay. Something that connects those two. 1, 2, 3.
Stem.
Vein. Oh, I was thinking of the veins in the flowers.
Yeah.
The stem. Okay. So something that connects the vein and the stem. Okay. So on 1, 2, 3.
Oxygen.
Body. I was going to say body. Okay. Body and oxygen, something that connects those two. 1, 2, 3.
Blood.
Breath and blood. Okay, so breath and blood, something that connects those two. 1, 2, 3. Heart.
Vein.
Heart and vein. We're
Artery.
so
Yeah.
close. We're so close. The heart and the arteries are so close. Okay.
We keep
Heart.
going until we guess the same thing. Is that the goal?
Yeah, that's the same goal. We can go outside, so not to get too specific. We can say something that's more broad that connects the two. Okay.
Yeah, this
So
might take a while.
yeah, we're very close. So artery and heart. Okay. 1, and we can't repeat what we've already said.
Okay.
Okay. So 1, 2, 3.
Cells.
Cells. Okay. I was gonna say body, but I'd already said body, so that was out. So cells and I was out. So okay. So let's start over again at artery and heart, something that connects those two. One, two, three.
Tissue.
Circulation, circulation and tissue, something that connects those two. One, two, three. Water.
I blanked on that one.
Okay. So something that connects circulation and tissue together. One, two, three.
Cells.
Cells.
I don't
Cells.
know
We
if I
can't.
already said that. Did I already
You
say
already
that?
said cells. Yeah, you already said
This game goes on forever.
it does. It does. So I think that's a good ending for this game. We got very close. We got very, very close. And the whole point is just to say the first thing that comes to our mind, to not overthink it, and to not, yeah, just basically to say the first thing that comes to mind so that we can have the free flowing thoughts.
Yeah,
Um,
I like it.
okay. So, with that being said, let's dive into our questions. Doctor, you've spent over 10 years helping patients with chronic rheumatic diseases. How do you balance the challenges of managing these conditions with helping patients find joy and quality of life amidst their diagnosis?
That's such a good question. I think a lot of it is really identifying what patients or what our people are looking for. Because if they're looking for pain relief or more activity, being able to do more things that they enjoy, it's really about bringing the things that light us up back into our life, because we know with illness, chronic illness, pain, or inflammation, it's really easy to start giving up things. Like you might give up doing things with your family or your friends, or you might start to really like ignore the things that once brought you joy and pleasure. And so as we start to heal and incorporate, healing through medication, through food, through activity, bringing back a lot of that stuff, I find for myself when I start getting kind of into a slump of like, I don't feel like I'm making any progress, just being out in nature helps me rebalance. Just going for a walk or starting to, acknowledge and see things. The first thing that came to my mind today, I think a lot about just like blooming, spring right now. So like blooming and like how is the earth sort of coming alive? And I like to translate that when I take care of patients and talk to them about like how can we sort of bring out the inner like bloom in you. Sometimes men don't like to think about it like that, but how can we bring out like the innerness of what makes you unique and makes you by healing your body? So I think that's one way to incorporate bring joy is just really thinking about what connects you to the greater world and what helps you realize there's more to it than just sort of the day-to-day routine of it all.
I think that's so important. Also, bringing back those things that people have given up on, like you said,
Hmm.
because they could no longer do it because of their pain. But now that they're in treatment, they can start incorporating those things that brought them joy back into their life.
Yes,
And I think holding on to those things and realizing how important they are, even if they're small, is very important as well.
absolutely.
So, with that being said, you mentioned briefly about how you maintain your own well being as far as being outdoors, but what other things do you do for yourself as you advocate for patients and educate future healthcare providers? What do you do for your own well being?
I love to read. A couple years ago, I started getting back into reading for fun, but incorporating things that tie in like tools or techniques that I would use for work also. I gain a lot of, I guess, my approach to patient care through reading parenting books, believe it or not. So I have three boys, and going through the different stages and phases of parenting, I've learned a lot about communication. I've learned a lot about just being patient and letting the other person contribute to the story. It's not, medicine used to be sort of the professional dictated the plan to the patient, but now we're realizing we need to intercept the information that the patient's telling us and hear that and then provide feedback based on science, based on our understanding of what's going on with medications, with, science and their disease, and provide feedback about ways to help. So for me, a lot of it is incorporating different things. So I mix kind of business books so that I learn to be, I try to become a better leader and communicator in my own practice and in my own family. I read parenting books. I'm not necessarily reading to do the thing always. Sometimes I'm more just reading of like, oh, that was a really helpful tip and I can try that out in my own life. And then sometimes I just read stuff for fun. I'm not a huge fiction reader, but every once in a while I'll pick up something that doesn't really have, a basis to what I'm necessarily like going through in my life. But I love memoirs. I definitely love like celebrity memoirs.
Mhm.
Um, so I have a bunch right now in my library queue that I'm waiting to read. I love reading books about like politician leaders, especially female leaders. I went through a phase where I read a lot about Mount Everest and like the people who climbed to the summit, just because so much of when people tackle a big goal, right? It's like learning their mindset. I read some books about sports and athletes because it's like, how do they talk to themselves that I can learn how to talk to myself and succeed in whatever even a teeny goal if I'm setting for myself. So reading or listening to audiobooks is a big thing that I do for myself. I also love I just like hanging out with my kids. They're so funny. Kids are really hilarious if you just let them be and let them talk. I have a 10-year-old, a 7-year-old, and a 5-year-old, and they are just hilarious human beings. So just being around them and laughing, I think, any situation where you can kind of get yourself to giggle and laugh and have fun, it creates, those feel good endorphins where you're like, okay, this helped, you know, turn a rough day around. I live in Arizona, so getting out in nature is something that's part of the reason I moved here. I was in Chicago before and hibernated half the year in the winter, so I love living in Phoenix now. I think it's important that we take time to go on vacation and really like unplug. I started doing vacations where we were kind of camping or glamping, so we weren't like tied to a TV always. And that's one way to really like reconnect. Sort of you're forced to kind of sit and think and not necessarily just like drown out in front of a TV. So I like doing things like that. And then just really connecting with, people. It's really easy that we just get caught up in the routine of it all. And so bringing back those connections with friends and family and even just my husband having that one-on-one time where we kind of just talk about things and not necessarily have an agenda. It's really important to like reset. So I think for me, a lot of it, I'm an introvert at heart. I consider myself like an extroverted introvert. So I love to chat and talk, but then at the same time, I like need my time to recharge. So for me, that ends up just kind of being, either journaling or reading or things like that. I'm kind of a homebody, so that
Wow,
helps.
you gave us a lot of useful tips that you practice. I love that you look at the mindset of people who are accomplishing big goals as someone that hopes to accomplish big goals, and it gives you that extra inspiration to accomplish your goals.
Yeah.
Um,
I
and
kind
then
of figured out that hack. I was reading business books for a while and not necessarily feeling like I really like connected with business leaders. And so then I sort of went into like the celebrity memoir phase and it really like dawned on me, I think, where it's like, everybody has a story to tell, right? Whether you're actually famous, whether you're just, a regular person doing a regular job, we're all overcoming something. And that story is really powerful how we get to portray it. And when I think about like what makes people interesting, it's learning a lot of that because those are the people in front of us at work, right? Those are our patients who come in and are really struggling with something, right? But they could also be people who have big goals and big dreams and are limited based on the way that they feel. So I started reading about people's stories so I could connect in a way where it was, oh, I've recognized this pattern before, or I heard this mantra, right? Like a lot of athletes are very consistent in the way they approach their day. It's like, I do this, then I do this, then I do this, and I warm up this way, and I do the same thing over and over so that when I'm competing, I'm not nervous because I've already done it 1,000 times and I'm not jittery anymore. And I think a lot of the skills that we can develop and evolve in leadership or just in being good communicators is that repetition of like, okay, I tried this tactic and it didn't really go over very well, right? Like comedians practice their jokes hundreds of times before they get on the stage. And when it dawned on me that like everyone is practicing for something, it was okay. Well, I can read something that is interjected with humor. So I started off with Matthew McConaughey's book, Green Lights. And I was just like laughing so hard, I was crying. And I'm like, if this is the world of celebrity memoirs that I've been missing out on my whole life, I just started like consuming. And it just ended up being really fun. And then I kind of went down the path of like, okay, this person accomplished, a big goal, or this person was a politician who accomplished this. I got really in depth with Michelle Obama's book and Barack Obama's book. And just then when they're the nice thing about audiobooks too is usually the author reads the book. So you're hearing them tell their story. And it's so powerful to just be like, oh my gosh, this is amazing. And then if they can do it, it's like, well, shoot, I can incorporate these little skills or these little tweaks into my daily, habits or life hacks. And to me, that was just something that was okay. This was a successful pattern that, somebody successful did. And then
Mhm.
you kind of start to see the benefits of that way of thinking versus I think it's really easy to get sucked into romance and drama and fantasy, and those are all great if that's what you're into. But at the same time, it's for me, I'm interested in like, how can I be the best version or a better version of me by learning through these great people? Not necessarily like, I'm not going to get to meet all of them, but like by consuming their stories, you feel like, okay, they've given me some wisdom, right? Like we've just had a one-on-one session with them
Mhm.
telling me all the things that made them successful.
Yeah, definitely, definitely. Memoirs are very interesting. I read a recent memoir that I read was Beyonce's mom's memoir, which
Oh,
was
yeah. How
so
was that? That's on my list.
it was so interesting. Yeah. I thought it would start mostly like from, of course, like having Beyonce, but it started back in the beginning of her life and her very humble upbringing in Texas. So it's like she really accomplished a lot even before the kids were stars. She was an entrepreneur in her own right with
Mhm.
her beauty school, which was really interesting. Like not beauty school, but she had a beauty shop, but she was unique in the way she marketed her beauty shop so that it was very profitable
Mhm.
right off the bat because she had a target population, like, where she targeted working women, she had a avatar of who she served,
Yeah.
so that was very interesting, very, very interesting. It was an interesting book. With that being said, let's go back to speaking about patients a little bit. So, with patients with chronic conditions like rheumatoid arthritis or lupus, how can they take more ownership of their health through education, empowerment, and mindset? I know like patients are people and they can take a lot of the tips that we had today, but how can someone who's particularly suffering with a rheumatologic condition kind of learn more and take more ownership of their health?
That's a good question. I think a lot of it comes from asking questions when you're at your visits. So if you come into a visit and you're engaged and providing feedback and asking questions about the next steps, if you're not necessarily feeling well, it promotes, more of a team-centered approach, and I understand it's not always possible for every situation. I come from a region where there's multiple ways to see a rheumatologist, and I recognize, geographically that may not necessarily be the with the advent of, or the utilization rather of telemedicine and even direct care where you can meet with a practitioner who's servicing a broader area over, multiple states even, just to be able to interact with somebody who's helping align with you and your goals, because the least effective treatment plan is one in which you come in and don't really talk about what you're going through and just get your refill and your blood work done and then you're done. You're out the door, right? It's like I think a lot of people leave those types of visits where like, I didn't really get a chance to say what I wanted to say, or I had a list of things in my pocket and I just didn't pull it out because I didn't want the doctor to get upset or be rushed or irritated. And if you have the ability to partner with somebody who isn't rushing you as a patient, who comes in and gives you the opportunity to speak and ask questions, I think that's really what medicine how medicine works the best, because then it's a feedback approach of, okay, let's try this. Like today, for example, I had an agenda of what I wanted to talk to a patient about. And I went through a whole spiel about medication options. And then she asked, well, what about this lab that you did for me however many visits ago? And I was like, oh, yes, thank you for reminding me because this changes our whole plan.
Mhm.
And I was kind of caught up in the moment of like, I've got to get through this visit because I have XYZ also going on that I'm thinking 5 steps ahead. But it was that like, nope, pull me back to reality. Like I have to address the issue right here, right now, right in front of us. And so if she wouldn't have asked that question, I would have probably just kept going, glanced over her labs and not necessarily like made that connection myself. Or maybe I would have after the visit was over and had to call her back and say, I'm sorry, everything we talked about is now we got to rephrase. So that would have been like double the work for me instead of just like sitting back, letting her ask the questions, letting her give feedback based on what we talked about. And then we decide together. And ultimately, we came to a really great plan. And I think, she was definitely felt heard and her questions were answered. But the reason I bring that up is because we have an idea of what we want a patient's outcome to be with a type of treatment plan that we propose. But let's say you didn't necessarily have somebody who's a planner. I'm a planner. So I'm always thinking like, okay, what's the next step? What's the next step if that doesn't work out? But if you have somebody who's coming in and just kind of checking, looking over your labs and refilling your medications, you have to be the planner. As the patient, you have to be engaged and want more for your health and for your healthcare. And so if you have the ability to ask questions and provide feedback of like, I really do think this medication's giving me heartburn since I started it, or I've just noticed I'm a lot more itchy now, or a common thing with some of our medications in rheumatology is hair loss. So I have some patients who are like, I'm feeling better. I think the medicine is working, but I'm losing a lot of hair. And there's tools, there's ways that we can work with that without necessarily derailing the way your body feels. But if people don't bring that up, how are we going to know, right? Like nobody is a mind reader. Nobody knows what's going on behind the visit. I think about like Oz and like behind the green curtain. Like the minute you walk away, we have no idea what's actually happening. So you have to stand or sit in front of us and tell us what's going on. So I think for patients to feel more empowered, it just starts with asking questions. And if you feel a little intimidated or you're not quite sure how to start with that, even rehearse it on the way in and think about like, okay, I need to make sure I ask at least these top 3 things before I leave so that I feel better informed. Because what happens, right? You get home, your family asks questions. Oh, what did you talk to the doctor about? And it's like, oh, nothing. I just got a refill of my medication. And then they're like, well, you're complaining about things. You're not happy. You're not feeling better. Why didn't you change anything? And then it really has to be that approach of like, if you try, and I also understand, I fully recognize people who try and get told no, or try and get told, well, there's no other option, or, this is the way it is, this is what we have available. But those instances, right, like medical gaslighting, the culture of being told that you don't have options,
Mhm.
that is where we can pivot. And that is where a patient can feel empowered to say, okay, this is not productive for me. I'm going to go seek out a partner in this, a partner in my healthcare to help me discover either another person or another clinic or another avenue where I might be able to get some answers. And if that is by aligning with a different type of, practitioner, maybe your primary care is a big advocate for your health who can kind of decipher some of those nuances. But I think there's ways, even in what we call like medical deserts, where there's little access to changing care, right? Like, let's say you're seeing the only rheumatologist within 2 hours of where you live. There's still ways to get information online, whether that's social media, whether that's like, healthcare websites, whether that's understanding the actual diagnosis that you have, and then being parts of groups that ask questions. I have a patient who I saw today who has Sjogren's, and she comes in every visit and tells me, well, I read this on my forum, or I read this in my Facebook group. What do you think about this? And we sit and talk about the feedback that she sees and reads about. And we kind of decide, okay, well, this sounds legitimate. Like, yeah, I didn't really think about that. I think this might be something we could try. Or on the other side of that, I ask her, well, what are you learning that I can then help more patients understand? Because it is about, knowing the myths versus the facts, right? Like all these medical mythbusters and all these people claiming to fix autoimmune diseases with smoothies and supplements and stuff like that. Like, what is a myth versus a fact? But it just really starts with asking questions like, is this possible for me? And you can even start with like a neutral question, like, could there be any other alternative to what I'm doing now? And if your doctor says no, well, why might there not be any other option? I read about XYZ, or I saw a commercial about XYZ. So like, why might there not be another option? Because as much as, our last question, we talked about like, how do I educate myself? We owe it to each other. We owe it to ourselves. We owe it to our patients to educate ourselves about what is current and what is being used in our fields. Not all doctors are going to be as up to date as others. And so if you have one or a healthcare provider who just doesn't seem like they're giving you, current options, it might be your role as a patient to advocate for yourself, to bring them. I read this article. I thought this might be able to help you maybe with another patient who's like me, and just kind of give feedback of like, there's a whole world of options out available and we haven't talked about any of those. Why are you holding back and talking to me about that? And if people get mad, that's on them, right? It's
Mhm.
not a reflection of your worth as a patient because you're trying to advocate for yourself.
Mm. I love that you are helping patients become advocates for themselves, and they can start by practicing something that we learned from the athletes, right? Just practicing their questions, writing down their questions ahead of time, and being prepared for their visit.
Yeah, I really do. I do think it helps. And I think it helps, if you keep coming to appointments and asking your doctor, your healthcare provider questions and they don't have the answers. I mean, I had a patient come to me once and they're like, this is what I researched. And it's like, oh, okay. I didn't think to go down that road or connect those dots. So some people just don't necessarily see that connection, right? Like the game we were playing. It's like, what in your brain do you see that connects the dots? And medicine has gotten to be so complex. I mean, every day I have people, they're like, why can't you just be my everything doctor? And it's like, I do not have enough brain power to fit it all in my head. Like, there's just no possible way I could be everything anymore. It used to be there wasn't as much information to know, but now there's just too much. And, when we think about how fast AI models are changing, right? It's like every 2 weeks there's a new model learning more and doing more. Well, our human brains are not up to the capacity to know all of those medical things. And so we just have to realize, like, we do need each other. We need a community of each other. We need to understand, we are limited to a certain degree. And so I think it really does come down to asking, it's really just asking questions.
Hmm. Definitely, definitely. So, with that being said, we are on our wrap-up questions. So, who is a model for joy in your life and why?
My kids. I think my kids really emulate joy. All of them, but my 5-year-old right now is just the biggest goofball and like sunshine ball of he just emanates joy. It's hard not to like giggle when we interact. So, but I think collectively I have to say my kids.
Hmm. And if you were cooking a cake of joy, what would your top three ingredients be?
Oh, like what
Metaphorical
makes
cake.
joy? Is
Yeah. Metaphorical cake, like what brings joy? What are the top things that bring you joy if you were cooking a cake of joy?
I think smiles or laughter, those kind of go hand in hand. For me, it's like brightness. Like I'm a very visual person. So being around bright things with light is joyful. And then right now, I think in my phase of life, it's home. I love my home.
Mm-hmm. Love that. So, if our audience wanted to learn more about you, they can find you at rheummentor.com. It's RHEU mentor.com. And also your apps at Dr. Brittany Panico. You are on social media. Where can they find you?
Yeah, so my room mentor website's under construction, so that's coming. So definitely earmark that for the future.
Okay.
And then I'm at Dr. Brittany Panico on Instagram, Facebook, and YouTube. And then I am on LinkedIn as well. Yeah.
Awesome. So thank you so much for joining us.
Thank
Um,
you.
Thank you. This was a great episode. We shared such valuable information, especially for any person who is visiting a doctor. So that's patients and people who are also healthcare providers. We also see doctors and we need to be empowered as well. So thank you. And you also shared such a valuable insight on about how you practice and maintain your joy. And you help patients do so as well. So thank you, thank you, thank you. If you're listening to this episode, please like, share, subscribe so you'll be notified of the next episodes and have a joyful rest of your day.
Thank
Bye.
you. Thank you.